My outfit because I had the sweater on less. Ah, hello. So, oh my God, this is literally heating up. So Charmaine Jackman here from InnoPsych with my two friends who we are connecting on in treatment. Dr. Vanessa Prosper, and Dr. Shani Turner. So
good evening.
We're just gonna, you guys want to say anything? We're just gonna dive in.
Yeah. No, I'm ready to dive in. Good evening. I hope you were able to watch. If you haven't watched and you're gonna replay this, please watch. There's just so many gems to discuss and pull apart tonight.
Yes. And anything you want to add, Vanessa?
I'm just going to say same. I think just like in the previous seasons of In Treatment, it just sucks you in. It's so good. And you just want more. And, definitely as therapists, there's just so much there to unpack. Yeah. It makes it interesting. I think it reminds you of you love the work. So, yeah, just like Shani said, I really encourage you all to watch it.
Yeah. And I think too, it's like, again, I think we said this last time, but there's not a lot of times where therapists are portrayed in a somewhat realistic light. So it's really a great opportunity to use this. One of my former supervisors texted me today saying, "You got me watching this show. I'm supposed to be writing a report." And it got sucked in, right? So it's so
the good thing that to me, I think the good thing is they're 30 minutes. If this was one of those shows where it was like an hour long each episode, I think you'd really be in trouble. But we can spare an hour to watch these two shows. Like this,
right. All right, so we'll go in order. So we have Eladia on, and actually went back and watched the first one because we had some technical difficulties at the beginning. So there was a lot of, within 5 minutes, there's so much I missed in 5 minutes. I'm like, oh my goodness. So definitely a lot of boundary crossing with the honey and him calling her mamacita or mamita, little mama, which is the theme that we've noticed came through, how that has really connected to her own identity and loss of a son that she had to give up. So it's so interesting. So I'll do a quick summary from my perspective. I'd love to hear what you guys have. So here she is kind of connecting with him again. Some of the things that came up is him kind of rejecting treatment. Like when she tries to kind of go deeper, he's like pushing back. I don't want to go there. Really, I just want this lithium. And then he appears with these lithium pills, which I'm like, where did he get those from? And then there's there's a piece where he gets really upset with her. And, some of the things that I'm trying to rule out, is he having a manic episode? Is there some paranoia that's coming with his anger? He shares a little bit more about how he comes to meet the family. And there's a lot of defensiveness or protection around the family, but I think it's also a cover for his own anger that he holds towards them. So what else for you guys kind of popped out?
I liked in the beginning at first I think I was cautious to think about where she was going when she was asking him about the pills and to count the pills and wanted him to kind of go see. I was like, okay, where are we going with this? And then I understood therapeutically what she was trying to do, because if the patient was face to face and they had the pills on them, you might kind of have them kind of pull them out. Let's talk about this, that kind of thing. But I thought the deal, honestly, that she made was not realistic. And I think it's very important for our viewers to understand that, or anybody that watches the show today. Let's talk today, post-COVID, if that's what we can say now. Getting into psychiatrists, what's that weight going to be? The chances that you would be able to make the deal that in 16 days you can see a psychiatrist to write a script to see you, that means your psychologist, your social worker, your clinician has a relationship built where, yes, you can get a spot. But if that is not the case, that can be a weight And we're talking months, sometimes at minimum weeks before you'll get in to see a psychiatrist. So to me, when she said that deal, I'm like, and then even like we know the systems, right? Like whether you're in community mental health or hospital, to me, I don't want anybody to walk away like, you cannot wait for that 16-day window to have your next script in process, especially what he's saying that he needs this to work. So I was like, oh no, this is not going to work because he can't get down to the last two.
And I'm so glad you said that because I did not even pick up on that piece. I thought you were going to talk about the fact that she's kind of promising some movement in treatment that we're going to be working on stuff that we're going to get. I'm like, well, that's only 2 more sessions.
Yeah.
Right? When I did the math. Yeah. So, but that's an excellent point that you raised, Shani, about just the access to higher level services or medication, that it doesn't happen that way. I am glad though she kind of checked him about kind of having a script that's not hers, that someone's not prescribed to him, and the illegality of that and the potential harm as well. So she did a good job in kind of naming that and calling out that. But yeah, that's a great point. Excellent point.
Yeah, I agree too. Yeah, the two things, just promising, because he's, I remember he was complaining about like, you unlocked this. I didn't want to go there. Like, I don't have time for this. This is short term. And as we were saying, Shani, before, like an opportunity in terms of psychoeducation, what is therapy? How does the process go? Right. And it depends. It varies from people to people, but it's not something that's right away. Right. And for some people, short term is 3 months. It's not 2 weeks. So I don't know what he had in in his mind in terms of like short term. Is it like just enough to get my lithium and then I'm out, type of thing? But also, just what did she say? 2 weeks? I mean, no, 16 days is just like 2 sessions. That's it. And that can be, especially as you're trying to establish trust with your patient, that can be very deceiving for the patient if after 2 weeks, like, well, I'm still not in a better place about my issues, but also, I can't have my lithium right away and I'm out of it because there's a waiting list and, and all of that. So that's
particularly with the mode of treatment she's using, right? She's using more talk therapy, more psychodynamic. She does incorporate some CBT in terms of like the breathing stuff, but the way that she's approaching her work, I don't see that as any short-term treatment at all.
And I thought that his character is doing a great job challenging the structure of therapy. I think that there were 2 points that I was like, yes, this is a patient we could see. This is a patient that is very.
I have one of those. Yep, 2 of them maybe.
This is a patient that's very in tune with his ability to regulate or how he or she navigates through their mental health. And while they're not using our psychological terms, they are using what they need to survive. So he says to her, I'm trying to, this is me being careful. This is absolutely me being careful and thinking of the ways in which I can continue to work and eat and take care of myself before things kind of escalate into something that's out of control. And that is profound. Like, to me, I was like, absolutely, this patient is resourceful. This patient is figuring it out because he doesn't. And then when he called her out with the financial means, long term, if they are not paying for it, I can't see you because unless you're doing this for free, I financially cannot afford even these initial sessions or possibly the referral you're going to make for me to psychiatry. I can't afford that. So I think that there were so many times where he said some very key statements that were spot on with his past situation, where he's at right now. And that's what I said to you guys off camera, where I just wanted so much more psychoeducation from her. Like, I wanted her to hear that, validate that, and talk about how therapy can be structured in a way that can get to what he needs it to get to. Like, what is he thinking it needs to look like? Because he's communicating that.
Right.
what does he think it needs to look like versus what they really will have time to do?
Yeah.
Like, how much have these people decided they're going to pay for? Does he have 6 sessions? Does he have 8 sessions? What's their treatment goals?
Right.
His goal,
and at any moment that could be pulled away, right? He talked about this, I think, we were talking a little bit earlier about in terms of whenever she would ask about the DeMarcos, he would get very angry. Like, why are you going there? Why you keep asking about them? Well, you want me to say something bad about them, right? So it was his own kind of internal conflict with that relationship, right? And but it finally comes out, right? He finally just spews it, right? And you get to hear what it's actually like for him in this family, and it's really just about Jeremy. And I'm wondering, I'm curious about if Jeremy has always been disabled. Is this something that's new? Like, were they dating? So I'm just curious about that.
Yes.
I said the dating. I put he's relating to Jeremy being lonely, but I feel like there's another connection to Jeremy. Something's
It was him, and also him. Like, I actually put 2 arrows. I was like, he's also very lonely.
Yes. That's what I was telling Charmaine before off camera. Like, I feel like a lot of projection throughout the session to the therapist, to Jeremy, for our viewers.
And let's break down projection, what projection is for people who may not be familiar with that term.
Yeah, so projection in psychoanalysis is a defense mechanism, right? Where you are, I'm going to try to break it down in simple ways. Like, you are, the defense mechanism when you don't want to deal with something that's very anxiety provoking from your unconscious, right? So then you deflect because it's too hard for you. In the case of what's his name, Eladio, it's too hard for him to say, I'm angry. I'm angry at the what's the DeMarcos.
Or I'm lonely too.
And lonely, just like as a man. And so instead of saying I am those things because it's too painful for him to acknowledge that, then he projects that onto the therapist and saying, like, you're angry. Why do you want me to tell you that I'm angry at them? Or he's lonely, but when in reality you are. So you're just attributing what you are feeling to other people in order to not deal with your own feelings. So I felt like throughout the session, I was like, oh my God, that's like so much projection. But as you were saying, Charmaine, like, I think it reflects his inner conflict about living with the Marcos, but also being employed by them. And it just like exploded at the end where he's just like, I'm not the help, but that's how they view me. Right. And then you learn so much about him in terms of him not having been able to complete his college degree, being a college dropout, that he's only getting paid $12 an hour.
And I thought initially, like, this was a career for him, the way he had talked about it. So I was like, oh, wow, this is like very different than what I had envisioned. Yeah.
Yeah. Or even like, I think I wrote it down somewhere. I lost it. But, that's the reason why he's there, or he's still there, is because that's the only thing he feels like he's good at. Right. There's just like, it was just so sad. And just go ahead.
No, but that was also this obligation to Jeremy. And I think that's why I wondered about if there was a relationship, and I wonder too, if there's some other inner conflict there, right? Because why is he so beholden to this person who he kind of met at this restaurant? It's not quite clicking yet for me.
Yeah. But also he, like, at some point talks about Jeremy and saying, like, he's a transphobic Republican. Like, there's just inner conflict. Like, well, he's that mean, but then you still want to take care of him. So,
and she did raise that with him. She did say, well, why do you stay? Right? She asked very pointedly, why do you stay?
Yeah.
Because of Jeremy, so so there's more there.
Yeah.
For sure.
And I'm glad that you, Charmaine, I'm glad you said that, because that's exactly what I wrote down. I said, I feel like there was a sexual relationship. Yep. You met this man, you met this family at a restaurant. They have their son who is your age there, and you are lonely. You're feeling bad. Maybe you feel bad for him, but I wouldn't be surprised if there was just something there that furthers his relationship and connection to Jeremy. that it's not just a job. It's not the money, right? Like I assume that he's in this big house, that he is making money to the point where he's able to save so much he had to take this opportunity.
Right.
And
but you're saying you could work anywhere and make this like this. So what are you here for?
I also think, it's deeper than that in terms of what Eladio has told us about him so far, and the lack of connection with friends, the lack of connection with family. My mom was cold. So even though the DeMarcos are not ideal, for him, it's kind of like having a mom, a dad, a brother, or
he's recreating the family. Yeah.
Right. That's keeping him there, even though he's not getting paid well, even though he, describes Jeremy as a transphobic, Republican, even though he feels like the help. And I wonder if there's also like a racial, like he hasn't said that the DeMarcos are white or I don't know, but I just feel like, I'm not I don't want to be the help, and all of that. It's very interesting.
And there's also, when you talked about Jeremy, and again, this might be that projection too, like where he talked about like, I don't want him with food on his face, or there's something about dignity that came up for me. Like, doesn't want this person to be treated differently because, as a result or because of the disability that he's experiencing. So there's a lot, I feel like, just that personalized for him. And I'm curious like where that's going to come from. There was a point where, and I think part of that is the arc of the show, but from a therapist perspective, there was a point where he was really heavy and really intense moment, and he talked about getting the red sweater, and then she made a joke about, I can't imagine you being in this red sweater, which was true, but it kind of changed his energy. It kind of withdrew him from that intensity.
Yes.
And part of it, I know, is like, I think that's the theatrical. We needed to end the episode. But from a therapist perspective, you really want to have the client stay with those emotions. You really want to see where that's going to go.
I think there was along those lines, there was another time that I know myself have had this happen with patients, and the terminology is true to me in my experience with the African American community, the idea of feeling played. So when he said that, I was like, if you don't help him in that moment, that is so impactful for our community. And I'm from Boston, so it is something, it's natural terminology, and there's such a stigma with going and talking to someone and letting those emotions out. And I think even in other cultures, so I can think of like Haitian clients I've had, Cape Verdean clients I've had, that has not been okay, right? Like coming to therapy has not been okay. So this idea that any of the clients would come and use that language, like, I feel like you're not listening, I feel like I'm getting played, I feel like you're not hearing me. That's a red flag for me as the clinician, that whatever ways I'm communicating or what they're perceiving of how I'm speaking is not getting, that's not connecting. And then I feel like that's on me. That's not on the patient, that's on me. I need to address that in that moment. I need to stop and really unpack what getting played feels like for them.
Or what is it about what I did that makes you feel like you?
All of that. And so I was just curious if you guys heard that. Like, have you had patients that had that? And I think it is, that was another opportunity for some education, some psychoeducation around the nature of therapy, the structure. Why do I ask these questions? Why is it that you're feeling like some of these real emotions are coming and you're projecting? Would that be a great opportunity to talk to him about projection and talk to him about why that's coming and what your job is in the room and in the schedule?
Yeah, no, that's a good point, because I was definitely looking at it as I'm looking at like his energy changed. So I think it's so important to, because he said that a number of times, right? That whenever she bring up the DeMarcos, that would raise a flag for him. And I'm like, So I was like, is this some paranoia? Is he experiencing some mania right now as well? Yeah. But I think that's a really good point in terms of he's trying to understand kind of what's happening. And I mean, there's also like a part of mistrust, right? There's something that he's not trusting her motives in this conversation. Like he's really, again, his focus is on like, let me talk about my sleep and like, so I can get my medication. But you want to go talk about all these other things that from his mind are not related to why he's there.
Like, I don't have time for that.
Right. So they're kind of not at the same place. So I think that's a really excellent point. Yeah. All right. Anything else? And she went over. So then, she is drawn in. She is so drawn in. And again, like that happens to me because,
all the time.
But
I would not have ended the session that way.
No, that's what I was thinking.
Oh, and like they did this dance. There goes the boundaries. So I love this week. I think, much better clinical session, right? I think that I would have liked some psychoeducation. I would have liked some more from her, but this was a much better week than last week. But then she did exactly what we saw week 1 at the end. Like, you see what he's doing, right? Like it was as if he was like, okay, no, you're going to offer to meet with him, but he doesn't have to pay for it, right? So now, okay, is that what you're going to do every week? Every week, are you giving him a pro bono? Okay, she got him counting 16 pills and he can't sleep, so he can call you at 10. And then when he says, well, you told me to call you. You told me you would be there. Like, he's not lying. You are telling him those things. Yep. You are breaking the boundaries you're setting up. So you can't do that with this particular patient. You can't do that because they're looking at you as a mother figure already. And then she's going to close the screen. You close the screen after he's like, and then you're like kind of reprimanding him. Like, look, either you take the session or you don't. That's how I felt her saying that to him. You call me if you need me. It's like, yeah, but if it's at 2 a.m, are you answering?
Or like you have other patients. So like, when am I actually going to call? Yeah. So it was definitely not a great way to end the session. She did not wrap it. I mean, I think she felt bad that she was ending it that way. She just like left him there. I mean, they were in a very heavy place, right? His anger, she'd not really kind of given any strategies kind of, to work through his anger. So he was still pretty worked up.
Yeah, because I was going to say, what did you think? Because I wrote it down. Because she said something like, oh, yes, I'm going to call you, or we can, like, have some time later when you'll be in a less emotional place. I think it was the best thing to say. I was like, oh.
He was like, what is that? Like, he kept calling her on stuff, which I love, right?
Yeah. I was like, no.
Yeah. All right. So on to Colin.
Yeah.
I love Colin's scene open up and him just
in the car.
So in terms of energy, I feel like there's a lot of parallel between these two clients, right? There's a lot of anger. Well, yeah, in some ways. So Colin is talking about waking up from waking up terrified.
Yes.
And she connects that to some PTSD, and he finally unfolds. It's interesting that he does a lot of minimizing of his, like, he doesn't want to go there, right? He is also so defended. I think we talked about that last time. She gets him to open up, tells a story. He does not he has zero accountability for any of his actions.
Oh my goodness. Yes.
No remorse.
Like he's the victim.
He's a and I love, right? And the beauty of this, I love, because it plays into the DEI work that I do, the diversity, equity, and inclusion.
Yeah.
Because this, he's like 4 years later, and there's this race stuff that they're talking about, but they're not being necessarily explicit about race. And then he's like, everybody hates this, right? And he does this white male privilege, like he did. So anyway, and then he compares himself to Martha Stewart, and says when she went to jail, people still loved her. So he hated that this woman kind of like blasted him. But
yeah, because to me, it's like the underlying like misogyny and also racism, like, right? It's just like pointing at women, but also when he was talking about that Puerto Rican woman that he assaulted, I was like, oh, what is that about? I was like, oh, no, I was just trying to help her. To me, it's just like the epitome of like white privilege, right? But I was trying to help her.
The good racist, right? We have that good bad, right? I'm not racist because I'm a good person. I donated to NAACP and all these other.
Oh, he dated Black women.
Yes, I dated several Black women.
Yeah. I was like, oh my God.
I never voted for a Republican. I mean, the list that he made in his mind was a list for himself of why I don't need to take ownership for anything that I've done.
Mm-hmm.
Yes.
I should
or that I could be racist.
Yeah.
Right.
I should still be of value. Even though I broke the law, I did things to people that was not honest, and I had to pay the consequences. When I get done, you should still love me.
Mm-hmm.
Because why not? I'm white. I'm a white male. Why would you not? Why do you have a problem with me? I've donated to people. These people, I've loved gays. I love transgender. I love everybody. But no accountability. No accountability. And so even before we got to him kind of opening up, right?
Mm-hmm.
I was wondering if the back move, the back injury, my back is hurt.
I think it felt really intentional, right? Like she was like, let me switch the energy. Yeah. I did wonder, is that for real,
because
or she was going to ploy?
I think it disempowered him, but it also empowered him. Like, I feel like it empowered him, and he went into her chair and he was like, let me
say, I feel powerful. I wrote it down. He did say, I feel powerful.
So I was like, oh, I gotta try that,
Yeah.
Oh, my back hurts. Let me move over here so that you get the patient to feel like, because he already was coming in. I think if we look at just the first couple of seconds, minutes of the session, I didn't believe anything he was saying. He was just like, yeah, I've been just reflecting and it's going great. And I just,
it was all BS.
It's like, sir, Colin, come on, let's get to it. You got 3 more. This is the second session. You've got 2 more. You are playing. We don't have time for this. So I feel like when she did the back thing, it shifted that power.
That's true. That's true.
And it allowed him to sit in the seat. And then I also think, maybe like, I like the movement. I like that he's able to move in the chair too. And he's not like stuck on that couch. And not, remember in the first session, he got up. So I wonder sometimes, like, some of my adolescents, like, they need things in their hand. They need a toy. They need a piece of candy or something. And I just thought, like, if you look at the session, he is constantly just moving and trying to engage with her. And then she's able to kind of disarm him a little bit, get him to like, okay, go. And he did it. He showed his true self a lot in this session.
I mean, yes. It was still hard, right? Because he still did I don't remember what the reporter wrote, but then
he remembered word for word,
right?
Yeah, and it was long. I was like, wow, that's.
But
so what about? Yeah, why can't he be honest, right? Why can't he be honest in this process, or with himself, right?
I think multiple layers. 1 is court ordered. 2, he is angry. And to me, he presents as somebody that I won't be surprised if there wasn't anger prior to being incarcerated, right? Yeah. So there's anger in situations prior to that. So he's trying to do his best to conceal that, to not show that, because this is court ordered in his 4th session. I need you to sign this paper and get this back to court. But I also can't imagine what he's saying, that this woman, being a Black educated woman, living on the hill, living in this fabulous house, that doesn't play for him in the session.
Oh yeah. Because he keeps saying, I'm not smart. I'm not that smart. Because she was saying, like, he intentionally picked a fight with this guy, which we know he did, in order to gain sympathy from the people on the outside. He's like, I'm not that smart. I'm like, yeah, you are.
Or and I don't know if you guys know too, it's just like in the beginning, like, he comes in his Porsche, but also the music he was listening to, which is something.
What was he listening to?
I think it was Simon and Garfunkel. because he refers to it in the session.
Okay,
but the music was oppression. Like they kept saying the word oppression, and he was like so into it, like he's oppressed, like he's the one that has been wronged, which is interesting. I think it's a nice spin on kind of like we're talking about, especially in light of this era right now, talking about anti-racist work and racism and all of that. And especially in terms of like being an ally for white people and being an anti-racist, right? So him saying all these things like, oh, I date Black women, I'm this, I'm that. It's like a lot of education about like what is racism. It doesn't mean that you have 20,000 Black friends and that you do this and you do that you
in the personal
biases, right? And so I think he was just really in this, he's submerged in this. And in addition to like whatever else is in his like luggage of issues, that makes it uncountable and the privilege, like it's just the intersection of so many things. It'll be interesting to see if he talks about his mother, or if he talk like, I think the next session is going to talk about like his marriage, or things like that. But I didn't think, Shani, about her doing this intentionally, but now it makes sense in terms of like switching the check, because yes, it definitely opened it up where he could not conceal his anger and agitation and all of that. It's really interesting.
No, it was a good move. But it was funny how she did it. I'm like, what is wrong with it?
I was like
but I love though, right, the writing, because it's this parallel to our race. What are the conversations that we're having as a society about race? Like they're displaying that in this session, which I think is beautiful. It was so funny though. I was like, I love the writer, because after he did his litany of all the things the lady wrote, I said, even before he did, something like that. And it was like the exact statement. Because I know he's going to try to try to pretend like he didn't know all of it. Something like that, And I said that, and then 2 seconds later, he said it. I'm like, yep. But I
feel like his prejudice or implicit bias did come out sometimes, when he was talking about like Eddie Murphy delirious. And she called him on that, which I loved. It was like, why do you think that like I'm on his side because he's Black? Right? Or when he said, my life was easy and yours was so hard. What do you know about her life? Is it because she's Black? So
he seems like he's experiencing, so the waking up terrified. It's so interesting because there's some clients I've dealt with similar situations, right? So that waking up with anxiety, right? And at first he's not able to make that connection to one, either right, just being in prison, right? But then there was also this very traumatic thing. So, again, thinking about that, hopefully she'll do some strategies that help him kind of with anxiety, to help think about ways that he can fall asleep or wake up. When he wakes up, how does he manage that anxiety that comes up, right? Because I was having this conversation with a client this week about that very similar pattern. Like when you wake up, you realize the vulnerability that you are at when you're asleep. And that can be very scary to know that you're in that situation. So what do you do when you wake up to help kind of bring the anxiety back down?
No, that's a good point.
I think what I think about with him just overall is there's so much more he's not saying. And and I wonder, will she get it? Like, how do they, like you asked the question about, I don't know if it was him or Eladio we talked about last week. Would they stay? Are they going to stay on? So was it him that we're asking?
Yes. It was him.
So
because they're court ordered.
But after this episode, you see him staying?
Well, he has 2 more, right? Because he has 4 sessions.
After 2, do you think he'll stay?
I think he's going to stay because with the court ordered, I think he's he needs her to sign off on some paperwork too. I guess I don't know if he's going to get parole. I don't know exactly his situation. Like, I think if it wasn't ordered, like, he probably wouldn't stick to it.
Yeah.
There might be a moment. I mean, I think it, and again, thinking about the process of therapy, it's like everybody that you see doesn't necessarily, it's not a good fit, right? It doesn't work.
Yeah.
And there's this kind of, you kind of are assessing, is this therapist going to work with me? Or if it's not, like, how do I move on? So the first session, I'm always talking with new clients about naming that process. Like, this is a relationship. If it doesn't work, let me know. I can change some things up. That doesn't work. Let's figure out how we can get you referred to somebody else. So, it will be interesting to see how if he were to stay, what excuse he gives, because he's not going to be someone who's going to say, I want to stay in this process because it's really helpful for me. Right?
Yes.
So it's going to be something that's going to happen, or he's going to sabotage, right? Because he sabotages himself. Mm-hmm. So there might be something that he does to sabotage.
Yeah. Or he's going to come back and present as just like he did at the beginning of this session. Like, everything's all right. Everything's cool.
Yeah.
I reflected and I'm sorry. I lost my temper, so he's so guarded. But the way that it ended, because he was obviously very agitated, like, definitely she touched on things for him, trigger points for him, right? Opening up that he didn't want to go there, but it's there. So it's going to be interesting to see what happens next time.
So both sessions didn't end good, right? Like, both sessions totally didn't end the way that they should have, in closing up kind of conversation and then leaving the patient walking out, not agitated, feeling good, ready for kind of the next week. Neither of them walked out like that this week.
And I missed the very end of this one, so I'll have to go back because I had some difficulties at the end. But so do you feel like, for Colin, what do you think he's getting from this session? Do you feel that he's gaining anything from this session with her?
I think he is. I think that he's not getting what he wants, what he's looking for. But I think it's important for him to have someone in his space right now continue to reflect for him, or help him be reflective of his own responsibility in what got him into the situation. And I think the only way that he, like, if the way he talks about people around him, like this week, he didn't use that word that he was using before. He kind of restrained himself out of, like, respect for the conversation they had last week. That's progress. Because if this man was walking around, like, just spewing this kind of stuff and not being mindful of the words that are coming out of his mouth, this week he's like, okay, let me think about that first, right?
He knows. He's very smart. He intentionally, I mean, he probably will do that stuff behind doors. He won't, I don't think he would do that in public, like in public spaces. So him kind of saying that to her, see, like, I'm restraining myself. I think that's very calculated. I think he's a very calculated person.
Yeah.
So
I agree.
Do you ever have clients you don't trust? Right? Because he's kind of bringing up that thing like, I don't know if I believe what you're saying. I don't know if I believe what you're telling me, right? So you guys, Shani, you sit back on that one.
I didn't think of it as, like, not trusting them. I thought of it as they don't trust me, right? That they are not comfortable enough with me to disclose to me kind of the truth. But I haven't been in the position yet where I just think someone's, like, completely lying and they're like, this is right. Like, I haven't been in that particular situation, but I have been in one where someone is guarded. They are not disclosing the whole truth. They're giving you a piece of the story, but that's not the full story because it just doesn't make sense. I think this guy comes in and he's just like, no, everything's fine and it's great and it's wonderful. Thank you so much. I'm ready to be back into society and doing my job, right? Like, I want to be a productive citizen. It's like, what are you talking about, right? Like, you want me to sign a form and say that? Like, that's not going to work. So I haven't had this particular manipulation. I haven't had this particular
It's so funny because I work in the forensic world as well. So I feel like I'm always like, you know, I have to like, I'm always patient with what I am hearing and waiting for other information to come out. So, but yeah. So another 2 great sessions. You know, they leave you hanging, right? They make it so you want to come back.
Yeah.
So yeah, I'm excited to see what. So tomorrow we're on. So tomorrow we have Layla and then her session. So yeah, oh yeah, we did debrief that one. Yeah, so yeah, it's gonna be interesting.
Yeah.
Yeah. And she was in another place at our house today. So they're just really they're just showing off her house. I'm like, man, you people. That's good. All right. So until
yes,
I'll see you tomorrow.
Okay.
Thanks for those who joined. Yeah, we'll see you guys tomorrow. Bye-bye.
Good evening.